2019, what we learned was that children in a certain neighborhood demonstrated the highest rates of childhood obesity in the entire city. And 100% of them were perceiving that there was not a park in close proximity to their home.
Wow.
And this was despite a park literally being across the street
Across the
from
street.
this neighborhood.
Hello, everyone, and welcome to another episode of Civic Pulse, Politics and Everyday Life. And we're going to be joined today by Dr. Liz Ackley. Hello, Liz.
Hi, thanks for having me.
Yes, we are both excited because today's episode is not only personal, local, and powerful, but we're going to be talking about the health of our children right here in Roanoke and how one project, the Melrose Plaza, grew out of what families had asked for and a need for the city. So, Dr. Ackley, introduce yourself to our viewers and our listeners.
Happy to. And Trish, thanks so much for having me.
Absolutely.
I am a professor at Roanoke College. I'm an exercise physiologist, so I'm really interested in how exercise can be used as a medicine. But I also direct the Center for Community Health Innovation at Roanoke College, and our job and really the role of that center is to help position residents to guide cross-sector strategies to mitigate health disparities. And that sounds like a lot of jargon, but basically my role is to make sure that resident voices get uplifted in community development projects that help families get what they need to make Roanoke a happier, healthier place to live.
And thank you for sharing that, because a lot of our listeners and our viewers don't even realize that we have the health disparities that we do right here in our city, right underneath our nose. And so we're going to unpack that today. And I just thank you so much, Dr. Ackley, for taking the time to share with us your expertise and your knowledge about these health disparities, in particular among our children. So let's just jump right into it. So number one, understanding the data. Can you tell us a little bit about RVCHLI, what that means and why it was created?
Absolutely. I moved to Roanoke in 2010. And actually, my expertise was in working with communities who are visually impaired. So all through my very early development, I was really keenly interested in how the built environment can influence health. And when I moved to Roanoke, it was like no other city that I've ever lived in. And I could very easily see physical barriers to active living just based on how our infrastructure has been developed. Because most of our health habits are actually developed in childhood, I chose, when I moved to Roanoke, to really focus my environmental emphasis on health, working with children, because if we can prevent chronic diseases before they happen, it's going to be less expensive and life will be much more enjoyable for the individuals that
Start early,
are
right?
affected by it. Yeah.
Yeah.
So the RV-Chile is the Roanoke Valley Community Healthy Living Index. And it's the region's largest health surveillance system that looks at health outcomes in children and matches that with what families are telling us are their primary barriers to physical activity and healthy eating. So we use geographic information systems, or just mapping technology, to overlay health outcomes in children, primarily overweight and obesity, with what families are telling us make it more difficult to lead a healthy lifestyle. And you know, it's one thing to look at data on a page, and I think for most people it's exhausting when you're just looking at data on a page. But when you can visually see it, it tells a completely different story. So I actually have an image that I want everyone to look at now, which is the obesity map of Roanoke. So if you look at this figure, what it's actually showing is rates of childhood healthy weight, overweight, and obesity across Roanoke City neighborhoods.
Wow.
And if I were to just tell you that we experience disparities in our neighborhoods, it would be one thing. But when you see it color-coded in this way, you can see very place-based patterns in high rates of childhood overweight or obesity. So in this figure, green means good. Anything orange or red means higher rates of overweight or obesity. So neighborhood disparities are really clear here as a result of being able to show things more graphically.
Sometimes you just have to see it, right? Just see it. And so that's really good information. Wow, we're so lucky to have you. I mean, you've done some extensive research and all of this is going to be really good information. What were some of the main barriers that families reported in supporting healthy behaviors at home, what were some of the things that prevented them from living that healthy lifestyle that we all want and desire?
Well, the cool thing is we've been collecting data through the Community Healthy Living Index since 2017. So I've been doing this now in 3-year increments citywide. So not only have we been able to understand what families are saying the residential address level, so in their homes, what are the barriers, but we've been able to track this over time. And what I find most interesting is the barriers that people experience have not changed since 2017. So from the standpoint of physical activity, in general, what we see is a lack of supportive infrastructure for physical activity. So families are identifying that sidewalk connectivity is challenging, or lighting is insufficient to feel safe, or the biggest one and the most persistent that actually rose to number one this year, relates to traffic. So the need for more pedestrian safety infrastructure and also traffic calming mechanisms to get cars to slow down. Roanoke's a busy place. There's a lot of speeding cars. And despite Roanoke's high impact traffic calming campaigns here for the last 6 years, we're still seeing that persist as the number one theme. But what's really interesting is when you back that from neighborhood to neighborhood, we see really different barriers in what families are saying. So in some of our neighborhoods, we will also hear things like high density homeless populations, or gun violence, or bullying. And in other neighborhoods, we might even hear barriers like weather, things that are more innocuous. So it helps us to identify the barriers that people experience at home so we can better craft ways for families to overcome those.
And so
Paying
you
attention to
actually
the
broke
data.
it down into neighborhoods.
Yeah, the beautiful thing about this data, this tool was actually developed by the Centers for Disease Control. So it was intended to be implemented by YMCAs. And the emphasis on this tool was to try to get communities to be able to understand the lived experience of people in every neighborhood. So when we added that GIS technology, the mapping technologies to this, families complete surveys for us and they give us their home address. So when they do that, I'm able to actually mine down to right where those families live. And then I can tell leaders across the city or resident leaders, hey, this is what we're hearing in your home neighborhood. What can cross-sector partners do to come together and try to fix it?
So, Dr. Ackley, do you think you got enough feedback from those surveys to get a real picture of what is actually happening?
I
in those
love
neighborhoods?
that you asked this question. It depends on the surveillance year. So in 2021, we heard from 84% of all families with a child enrolled in the elementary school system. So the focus of this tool is on 6 to 11-year-olds. So 84%, that's a lot of families.
That's a good number. That's excellent. Wow. That's excellent.
Unfortunately, in 2024, so this data is not yet published. I'm getting ready to publish this data in the next month. In 2024, the survey response rate dropped down to 8% of all eligible families.
We're going to definitely dive into that. I'm going to wait until we get done with what you found out previously in the last survey before we get into the new one, because I know you are bursting and
Yes.
I wanted to dive into this new data. But let's get back to where we were. So you talked to the families, you listened to the families, and one question I had was, can you share a story or a quote from a family that stuck with you?
I'll share my favorite story because it also shows how powerful this data can be. So the overweight and obesity data that we collect is gathered from every child in the school system from their PE teachers. So the response rate that we get there, that data set is always very robust. It represents the city very, very well. And in 2019, what we learned was that children in a certain neighborhood demonstrated the highest rates of childhood obesity in the entire city. And 100% of them were perceiving that there was not a park in close proximity to their home.
Wow.
And this was despite a park literally being across the street from this neighborhood. So that experience really showed me the difference in perceptions versus quote unquote reality. Something might exist, but be perceived by families as inaccessible to them if some other factor is keeping them from using it.
Wow.
So we dove deeply into what that was, and it was safety concerns. Safety concerns related to traffic, safety concerns related to just feeling unsafe and other people. And as a result, the Kiwanis Club built the Centennial Playground in the neighborhood where families perceived that no park existed. They put in I believe it was a $250,000 playground. It's absolutely beautiful. And now we've been able to see perceptions of access to parks and rec facilities increase in that neighborhood. And so some of the barriers that they had identified early on, we were able to overcome them by coming together, building new infrastructure, changing the lighting there, changing walkable ways for families to get there. And so really
So
listening.
that's the park that is right next to Melrose Plaza.
It is,
The one
yes.
perfect. Now that's a good story. So one final question in segment 2 for family voice and lived experience. Do families feel their school meals are nutritious and culturally relevant? And if you
Yeah.
can answer that, that's fine. We can take a dive.
No, I can absolutely answer this. So I've been talking about physical activity because that's my bread and butter as an exercise physiologist. From the standpoint of what people are telling us in terms of food, not only do we get information back from families about the neighborhood food environment, but we do ask them about school nutrition because these are kindergarten through 5th graders. So
Right.
the learned behaviors are going to be coming through school. One of the things that we did see in the 2024 data was that families actually do believe that the nutritional value of school food is good. And this is for the first time in our surveillance history. We're seeing a much higher rate of families demonstrating satisfaction.
And I'm sure that's good news for our superintendent at the Roanoke City Public School.
Absolutely.
The
Absolutely.
meals are
So
good.
I believe 80% of all families perceived they were satisfied, and that's up from something like 20% in 2019.
Oh, wow. That's a good number. That's definitely a good number. Well, I'm glad that you kind of gave us a stab at that because I was just curious about that. That's a good answer. So, unless there's something else that you want to talk about, family voice and the lived experience itself, I want to move on to segment 3 from the research to action. Do we have anything else, Dr. Ackley, you want to talk about in that previous segment?
Maybe just one more little thing to keep in the back of your mind as we transition to how this data catalyzes action is that only 70% of families with children in the elementary school system actually believe that the food they eat impacts their physical health.
Wow.
Only 70%. So we're down from 81% in 2021. And that is a perception that I hope to unpack with some partners so we can figure out how to change that.
Change that.
belief.
Yes. I mean, remember when we were growing up? Well, you're way younger than me, but we had this little video that would play commercial come on TV. You are what you eat, and showing the guy walking around with everything in his little tummy. So we've got to get back to that because literally we are what we eat.
We are what we eat. And I continue to find something in that every year the perception gets lower and lower. And there's something there that I would love to unpack and see if we can figure that out in the city of Roanoke.
But we're not there yet, but you would love to unpack that. Well, let's move on to segment 3, from research to action. How did RB, or you call it RB chili?
The RB chili, yep.
RB chili data influenced the development of the Melrose Plaza, which was huge.
Yeah, Melrose Plaza. So I was really fortunate to be able to lead pre-development activities for that project for 9 years. And it has been incredible to see what amazing community stewards Goodwill Industries of the Valleys is and bringing that to life in such an authentic way. So hats off to them. I continue to be blown away with how wonderful this is.
It's just absolutely amazing. My staff and I shop there at least once a week. I was there yesterday. I was
good.
Yesterday, yes. I mean, the fresh food, I mean, the meat products, the fresh veggie. I just think it's really, really a wonderful place to shop, and I keep promoting it. But anyway, back to that. I'm so glad it's there. And how did that happen?
So the Community Healthy Living Index is incredibly unique because it's one of the only surveillance systems that exists on children. And as far as I know, it's the only surveillance system that exists that documents the health status of every child in the city. So elementary school age. So to have such a robust data set and to be able to map that to see where challenges are and overlay that with the needs that families are telling us, funders love it. So the Community Healthy Living Index was actually what allowed us to join a very competitive national cohort initiative called the Invest Health Initiative. That's an initiative that's funded by the Robert Wood Johnson Foundation and was managed by Reinvestment Fund, which is a community development financial institution that tries to use investment strategies to reduce health disparities in cities. So Roanoke City became part of this national cohort initiative, and they helped give us the technical assistance that we needed for 9 continuous years to build a big transformative project. Melrose Plaza as a result of
Lord,
that.
huh.
Yeah.
Wow.
So,
And then there was that was a huge step forward.
yes.
Getting
And
firm in order to do it. The funding was the key piece. I know the city gave several $1,000,000. I can't remember exactly how many. But
yes.
people wanted to make sure that it happened, but if it weren't for the investment,
Well, and a lot of that is because of goodwill. So what's interesting is we had all of the pre-development pieces in place when the ARPA funding became available. So the city of Roanoke, through the federal ARPA allocation, dedicated about $10 million to that project. The rest of the 30 plus million that's gone into that has been all of goodwill.
wow.
So they've just done a great job. But throughout Invest Health, we positioned residents again as leaders because the Community Healthy Living Index showed us that if residents tell us what they need, the city will respond. And if people watching, if they get one thing, one nugget from our conversation today, that's what I hope it is. If residents follow pathways where their voices can be organized, city leaders will respond by putting their funding and putting their collective efficacy toward making that happen. The Community Healthy Living Index has proven that for me, and all of the other initiatives and programs that have been sparked from it just demonstrate to me that Roanoke, that we have a special sauce, that people really want to make Roanoke a really vibrant place for people to live and want residents to, be a big part in leading that experience.
Well, I agree with you 100% on that, Dr. Ackley. And in fact, I'm so glad that we did have some sort of responses from the surveys, because if we don't know, and I say we, I'm no longer on council, but I still feel like I'm a part of this community and
Yep.
even a part of the leadership in the city. Once you know and understand the needs of a community, then you can address them. And people may not realize how important it is to give that feedback or to participate in those surveys.
Yep.
It is so key and so important because nobody's mind readers. If we know what we're addressing, then we can create a way to address it. But if we have no idea what the issues are and what the barriers are and what impedes us, then we don't have a way to address it. So thank you for sharing that.
Yeah, and I think it's important for residents to understand that just complaining or just providing a recommendation is not the best way to do that, because you almost need an organized pathway. The people that serve us, they are serving us. They're incredibly busy. And so rather than just having recommendations become part of the noise, if we can follow organized pathways like the Community Healthy Living Index or like surveys put out the city's planning department, I think our planning team, they are the most unsung heroes in public health as our city planners. And so getting on planroanoke.org and using the mechanisms the city has put in place to facilitate the change that residents want to see, that is the best place for people to actually make action happen. So
That
organized voices,
organized,
100%.
yeah, because they really don't have crystal balls, but getting the information directly from the community can certainly have a meaningful impact on their decision making and that entire process. So all of this is important, and so I'm glad that we were able to kind of throw that in there and kind of unpack all of this at one time, because this is really good information.
If people just real quick want to understand the magnitude of that, in the last 6 years, I can give you some more of the initiatives that this data alone has sparked.
Please, that
So
was my next question.
just the surveys coming through the school system, that $30 million hub, Melrose Plaza, happened as a result of this data. We also had traffic calming infrastructure installed at the West End Center. The Centennial Playground that Kiwanis put in, again, $250,000 playground informed by residents. The Fallon Park Lift Center, so families can get dental care and all kinds of services through that elementary school. The futsal courts at Preston Park would not have existed without this data. Some families don't want basketball hoops and bike lanes. They want to play soccer. We converted tennis courts into soccer courts for that. The Complete Streets grant that the city of Roanoke just got came from that data. I believe that was another $250,000. And most recently, the city of Roanoke changed how the target neighborhoods were selected. So whereas West End was a target neighborhood, and then the Melrose Orange target area was a target neighborhood, and now Belmont Fallon. We have demonstrated that residents can make very impactful decisions for the city. And so this last HUD target area was actually identified by residents. We trained city leaders across every division on how to make residents leaders in big decision making, and it worked. That's a $5 million decision now that residents are making. So we've really learned, I think, by listening to residents in an organized fashion, that we can really put our residents in charge of big decisions in our city. That's awesome.
Well, RV chili has really made a big difference and a huge impact. Not sure, Dr. Ackley, if we even mentioned the impetus for that, or did we just dive right into RV chili? Because it had not been for RV chili, the the aforementioned probably would not have happened. And so it's important that people realize that this was really important initiative. Now, I don't know why, or I don't know what the impetus was for it between you or City of Roanoke College. Can we just back up? What made you do it? What was the impetus for all of this?
Well, I think that's the best part. I just wanted to. And so, right, it just demonstrates that people really, if they're dedicated to something they're passionate about and they find something that fits within their capacity to do something, like, we can really change the little world, right? I cannot believe what I and my colleagues have been able to accomplish. So I took skills that I have, and when I arrived at Roanoke College, I found this tool and adapted it, this tool from the Centers for Disease Control, and adapted it. And thanks very much to Sherry Hartman, who is a wonderful steward of great things. Shout out for Sherry always. We started this by piloting it at Hurt Park Elementary School, and learned that families wanted a school garden curriculum. So we were able to, she funded the building of a school garden. We saw how this could work. So I expanded from Hurt Park to Fallon Park. At Fallon Park, we tracked those children for a while, and we started seeing more very clear health disparities in our city. And actually, I do have an image that shows the health disparities in our city and how they differ from national estimates. So if we take a look here, we can see that in the city of Roanoke, let me make sure I get my statistics right, 42% of our elementary school children classify as overweight and obese. 42%.
Wow.
And that's compared to 34% nationally in 2024. And because we collect this data now citywide over time, so 2017, 2019, 2021, and now 2024, we can see longitudinal patterns in health disparities. So our children are consistently displaying higher rates of overweight or obesity than the national estimates. But again, we can look by neighborhood, and we can try through this data to serve those who need it most. But one of the other things I wanted to point out in this figure is if you take a look at 2021, you see a 5% increase above national estimates in overweight and obesity as a result of COVID. And so I'm happy to report in 2024, we've actually returned back down to pre-pandemic levels. So we're still higher than the national estimate.
But it is going down.
But it returned to pre-pandemic levels. And what I think this shows us, however, is that Roanoke City is vulnerable. We are vulnerable to outside forces. And so we need to be thinking in terms of action and prevention. Just to go back to your...
Even before the pandemic, though, the numbers were not where we actually would like for them to be, but they are returning to pre-pandemic levels. So
yes. And if we dive deeply into the data, here's my nugget for action. It appears that 3rd and 4th grade tend to be the timeline in childhood development where obesity increases most markedly. So something about 3rd and 4th grade is maybe where we should be focused on programming to prevent childhood obesity.
So is that when they're most impressionable? I know a lot of things happen in 3rd and 4th grade. They have to really absorb a lot, but that's when they start to change. That's when they start to develop those personalities. And
yes,
so that, I guess that's when it's really important for us to try to make sure that we're influencing them at that stage.
So really infusing healthy eating behaviors and physical activity in K through 2, I think is going to be critical for us if we're going to try to get ahead of the national curve.
Yeah, I'm with an organization called the Links Incorporated, and we go out once a week. We have not during the summer months, but during the school months, we go out once a week to work with 3rd and 4th graders on a myriad of things: bullying, gardening, hygiene. I mean, but because we feel as though that is the age group that is most impressionable and where we can really get some points across and change some of these habits early.
So Trish, what might be really neat is to do some focus groups with that age group to figure out, what do those children think they need? What are their barriers to physical activity and healthy eating? And what would they recommend to overcome them? Because again, it provides another avenue for us to uplift the people who need the intervention by telling us what they need.
And you already know what neighborhoods they are and what schools they are. So maybe I can talk to this organization and say, hey, what would even help even further, or what would help assist us in moving these students along in the right direction as far as a good, healthy eating habit, hygiene, is to have a focus group to hear directly from them. So instead of bringing in some of the solutions that we think are appropriate,
Exactly.
we would ask the students, hey, tell us, what would you like to hear from us? What would you like to know more about? How can we help you?
Yes, because I can almost guarantee that if you're doing this in different school zones, each school zone is going to tell you something different in terms of what they need.
We
Because
can't
of
just have this one program and say, okay, we're going to Hurt Park today. We're going to.
exactly.
uh,
This data has shown me that one size does not fit all, and that every neighborhood has its unique culture and heritage that we need to embrace. Give folks the things that they need in terms of their beliefs, behaviors, and values. If we can develop programs and infrastructure that feed into those beliefs, behaviors, and values, then we're going to see big change. But if we try to keep slapping on the same intervention for everybody, it's just not going to work.
Well, you know what, Dr. Ackley, I'm laughing because that's applicable with anything. It's
Anything.
well with our residents. It's applicable here in my office with my staff, with these students. So really, we need to listen to what individuals are telling us, whether it's the students, whether it's our residents. It all matters. So I'm really glad that you stated that, because we need to be a little bit more intentional when we go out to the schools and when we're talking with these students, if we really want to help, and we do.
Yeah. Yes.
Great.
That's fantastic.
What are the top 3 recommendations that you give the city leaders based on this data? And I say
Oh.
city leaders, but it could be anybody, residents, students.
Yeah. Well, the biggest recommendation always is listen to residents. And I will say that always and always, because every neighborhood is telling us something different.
Right. Okay.
But when I look at general themes on what families want to see in order to be more physically active and have better access to healthy food, we need to really focus on infrastructure and traffic safety. So overwhelmingly, families continue to tell us pedestrian-based infrastructure is needed, and that traffic safety is the number one challenge to being physically active across our city. So keep going, Regional Commission, keep going, Traffic Division in City of Roanoke. They're doing great initiatives. It's not enough, but they're great. And so how do we continue to fund those at scale? And then the other thing we're hearing from families is affordability of healthy food. It's getting harder and harder, and this rose as the number one theme for families this year. So if we can figure out how to support better cross-sector collaboration to incentivize healthy eating and making access to healthy food just easier and more affordable, and that's not something for the city of Roanoke to figure out, but that's something for the rest of us to get more creative in figuring it out.
And I don't know how much you know about LEAP, Dr. Ackley.
Yes.
I know a little bit about LEAP, but I went to a luncheon the other day, and they are actually doing that, with the mobile market,
Yes.
things of that nature. And now the store on Patterson, they have
Yes.
the market on Patterson with the Melrose Plaza, the Melrose Market. I think all of these in combination with what the city can do, because it's really not something that the leaders in the city would do, but
This is the private enterprise. This is what business is.
yeah, it's up to us. It's up to the community. It's up to organizations like LEAP. It's kind of like something we all have to work on together. But I do know that there is an effort, but it's like you said, it's not enough. But for those of you who are not aware of LEAP and its mobile market, reach out to me. I can give you all the information you need on that. The store, the market on Patterson, I passed by there yesterday. They had an open market on Patterson Avenue. And of course, the Melrose Market. And, there's the co-op there. Oh, I almost forgot about Lick Run. Lick Run
Oh, yeah.
has the farmers market on
Yep.
off 10th Street. So there are some options. We just need to make sure that our residents are aware of them. And
Yep.
that's the key.
And also that residents are aware of the incentives that all these great programs offer. LEAP does such a wonderful job of making that food affordable and accessible. So yeah, super props to them. They do a great job.
They do an amazing job. And you don't have to be of any income level. Anybody can shop at LEAP, the markets, the Lick Run market. That they would appreciate anyone shopping there to help support them. So you don't have to have a low income or median income. You could be super wealthy. In fact, I know some of my friends who can shop anywhere but choose to support LEAP and Lick Run Market. So these are things that we have to keep in mind for our residents. So if a listener wants to get involved, with something like this and to help guide all of us into healthier eating, in particular for our children and our students, what would you recommend to them?
Well, I would say just like myself, find something you are passionate about and then identify what is the level of capacity that I have to give to something. And I think once you put those two things together, then you find an outlet to serve. You know, a lot of people don't have hours and hours to serve community, especially families with elementary school age children, which is my target audience. But maybe they can participate so that their voices are being heard. And so I would say logging on to planroanoke.org is a great way to do that. The city planning team always has surveys out asking for community input. So if the only capacity you have is to have your voice on, shuttled through a survey that people are actually going to see, that's a great way to do it. But if you have more time to get involved, pick something you're passionate about and then follow those leads. Otherwise, it's going to feel like work and not play. That's the fun thing for me. I'm neck deep in data and I just love it. So there is something for everyone.
Well, Dr. Ackley, you have really been vital in all of this, and we cannot thank you enough. As residents here in the city, as city leaders, you did mention that you had some data for the 2024. Do you want to share that with us before we close? We have just a couple more minutes, but I want you to hit some key highlights, and then we'll close.
Yeah, I think key highlight some of the figures. I will make sure to make those available. I've got the map of obesity disparities across the cities that folks can see. That we've returned to
some links too, if you want to. I'm sorry to interrupt, but if you have some links you want to add, we can add those at the end.
I can link to the 2024 final report for the Community Healthy Living Index.
Awesome.
That way people can see exactly what families are saying in terms of the barriers they experience to physical activity and healthy eating, and also the recommendations that residents have come up with to try to mitigate those barriers. So I'll let people speak for themselves then. You guys can access the data and empower yourselves with what people are saying.
On their own. Well, in closing, I will say that the important takeaway from this to address health disparities amongst not only our children, but some of our adults that have really serious medical conditions. We have one podcast that came before yours with Dr. Polk talking about lifestyle medicine. So all of that
fantastic.
All of that working together is so important. So my takeaway is, number one, listen to your residents, your families, and your students, and listen to what Dr. Ackley just said about ways to get involved, ways to give feedback. I mean, because we won't know what we need to do unless we can get some feedback from our communities in how to address some of these health disparities. Now, Dr. Ackley, you want to have a closing thought?
I guess my closing thought is, especially to those that live in Roanoke that are listening, we live in a really special place. Change is not as hard as it is in other cities. And so I will always feel that Roanoke is magical in our capacity to actually make change for the better. My closing is just participate. What a wild ride this has been to see Melrose Plaza come to life. So what are we going to do next?
And for those of you who've not gone yet, go to Melrose Plaza, check out Leek, check out Lick Run Market. You know all about the co-op. It's been there for decades, but really you have other options. And thank you so much for listening today. Join us again in 2 weeks for our next episode of Civic Pulse, Politics and Everyday Life, when we'll be talking more about politics. Thank you, Dr. Ackley.
Thank you so much, Trish. Glad to be here.